All right, I will call this meeting to order. We will start with the consent agenda. All the following items which concern reports and items of a routine nature normally approved at AHA meetings will be approved by one vote unless any trustee desires to have a separate vote on any or all of these items. The consent agenda consists of the discussion, consideration, and action on the following items. Minutes of the monthly finance meeting on April 21st, 2015. Minutes of the monthly trustee meeting on April 21st, 2015. And a check report April 8th, 2015 through May 7th, 2015.
I move that we approve the consent agenda after dinner.
Second.
We have a motion by Darlene Sanderson, a second by Steve Knox to approve the consent agenda as it was presented. Roll call vote, please.
Klein.
Yes.
Jasper.
Yes.
Hannaford.
Yes.
Kinsey.
Yes.
Knox.
Yes.
Sanderson.
Yes.
Next is the CEO's report. Candace?
All right, upfront collections for the month of April were $32,405, which remains steady. For that, the homestead did show an increase in meals per month during the month of April. We went from 139 per day to 148, and I think that speaks to the fact that the meal service is getting better, and the residents and even employees are eating from the meal service. So they are over at the nursing home, and that is coming along as well. So we're pleased thus far with Carson's. The pergola, if you have noticed that at the convalescent home from the main entrance on the west side, that has been completed. It's for the residents to be able to go outside and sit in the shade if they want to get outside, and for families as well. That was a project that Janet took on, started raising money a couple of years ago, and along with the volunteers, and that was just recently completed this month. So thank you, Janet, for all your efforts to get that done. It looks very nice. Pat Nida did retire. We had a reception for her on April the 27th, and we certainly are going to miss Pat, and that's why Harley's here again, and Harley's coming along nicely, learning his new role. On May the 6th, we were blessed to have the State Department back to do their resurvey, and it went very well. If you'll remember, when we had our survey, we had some issues of not having everything in place with our infection control program. We were missing the tuberculosis assessment, and then with our quality plan, performance improvement plan, we just had not completely grasped. We had started the SQSS program, and so we've been on that about a year now and have made drastic strides in utilizing that software and understanding all of the requirements that the state is looking for in a QAPI plan. So they did clear all of our deficiencies, and our staff were commended on making those improvements. So we are good to go on that. Although my report does not reflect, it has been very busy. It's just not in my report. So if you guys have any questions, we'll start with Bo earlier. I did have the recruiter contact me this week, and he does have 2 or 3 positions that have some interest, and he's just trying to get them nailed down to coming out and interviewing. So we're hopeful that that will happen soon. Have any other questions for me?
Well, it says that currently evaluating software for the physicians' offices for them to begin the process to meet meaningful use. I assume there's a deadline for that one too?
Yeah, by the end of the year we need to have it implemented.
Okay.
So have a decision, yeah.
Any other questions for Candace? If not, I'd entertain a motion.
Mr. Chairman, motion to approve the Share Medical Center written report for May 19, 2015.
Second that.
So a motion from Terry Klein, a second by Dr. Kinsey, to approve the Share Medical Center written report for May 19th, 2015. Roll call vote, please.
Klein.
Yes.
Casper.
Yes.
Hannaford.
Yes.
Kinsey.
Yes.
Knox.
Yes.
Sanderson.
Yes.
Next is the CFO's report. Kevin?
Okay. For the month of April, we posted $1,693,625. It was a decrease of $56,738 compared to the prior month. And the hospital's revenue decreased by $68,116. The nursing home revenue increased by $16,811. And the homestead's revenue decreased by $5,433. We did have a slight decrease in patient days for April compared to March. We had 88 days in April compared to 93 in March. Our hospice visits for April were 121 compared to 140 days in March. Our clinic visits were actually down, but we're over the flu season stuff, getting back more to our realistic probably numbers that we're going to have for a while. We actually had 1,277 visits compared to 1,558 in March. The nursing home average daily census was 48.4 compared to 48.3 in March. Our contractuals were 43.5% of gross patient revenue. We wrote $57,086 off to collection agency. We gave $6,106 away in charity care. Our operating expenses, excluding salaries, benefits, and depreciation for April, totaled $495,000. And that was an increase of $77,390 compared to a prior month. And the reason that that was up so much was $67,000 of that was due to the SHOP payment. That's that once that we have to pay once a quarter that we have to pay the state, then we get reimbursed back for that. So we actually only increased by actually probably $10,000 if you back that out. Salaries and wages for the month totaled $481,499, which was a decrease of $13,242 compared to prior month. We had a net operating loss of $181,015. And net loss after sales tax, contributions, and everything else of $25,961. We continue to have cash on hand of $515,520. That's 14.8 days of operating expenses. And our accounts receivable stayed pretty much the same. It only changed by $244. Gross days are 57.4 compared to the prior month of 57 days. And our net days are 45.9 days. So accounts receivable still looks fairly well. If you turn over to page 2, you can see all the combined numbers. In the contractuals, one of the reasons that it was down so much was if you look underneath the Medicaid contractual, you can see it was only $7,223. It's due to an accounting thing that we have to do with the SHOP payment. When we receive the cash back in for the SHOP payment, that decreases the amount of contractual we take. But then we have to turn around in the other expenses and expense it. So we have to show it as an expense, and then we have to show the revenue as a decrease in contractual. So it's really just a wash, but it does change the expense line items. You can see we're up almost that $79,000, but like I said, $67,000 was due to the SHOP payment. Page 3 is kind of all the other expenses. Really the only items there that was kind of up a little bit was in some travel and education. We sent some nurse aides off to get some education. We pay for that. And then had some meetings for our dietary staff to go to and some educations for our practitioners and stuff. So that was the increase that you see there as well. If you look on page 4, the 2 years side by side, you can see we're up from all operations $2.3 million in gross charges. We're at $16,506,000 for the through April. We're up actually with expected cash where we should expect cash for $8,917,000 compared to $7,900,000. So we're up almost $1 million in net cash. The big change though is in the other operating revenue. It's down $1 million from last year, and that's due to the fact, like I've told you guys in prior months, was the EHR money was $700,000 less than prior year. We also, last year, we got rid of the Cimarron, which was another $250,000. So that's the reason you see that line item go down. Net operating income overall year to date, we're at a loss of $1,118,049 compared to a net income last year of $499,114. And the bottom line after sales tax and everything, we're at a net profit of $173,457 compared to $1,438,212. So the next page shows you the hospital's income statement. The hospital actually made a net income for the month of $2,420 after sales tax and everything. Year to date, the hospital's at a net profit of $357,088. Last year we were at $1,292,000, but most of that was due to the EHR monies. The next page, page 7, is the nursing home. We ended up losing $30,658 from operations there. And year to date, we're at a net loss from the nursing home of $272,857 compared to last year net profit of $65,689. The homes.
That part of that is due to allocations.
Yeah, and most of that is due to from last year. This year is the allocations that we have done. We went back and actually allocated. In the past, the hospital has had all the expenses for utilities, insurance, and all that stuff. So we were actually reallocating the expenses that was used by the nursing home back to the nursing home. They were probably about in the same position for the 2 years. We're just getting the expenses back to where they should be. So the homestead made money. They made $2,236. And year to date, they're at a net profit of $89,226 compared to $80,500 last year. So they continue to do well. Page 11 and 12 is just your accounts receivable. Really, the only thing that I might point out is that last month we got the charts or the bills out a little bit better. The physicians getting their dictation stuff in. We had unbilled at $277,034. And we're right at 5 days of unbilled. So that's really a positive thing. Getting the bills out and gets paid even back quicker. So that's a positive thing. The next, of course, is balance sheet following that. And the rest of it is statistical numbers. And you can see, if you kind of look at year-to-date numbers and even month-to-month, that almost all of our volumes and lots of the areas are better than they were last year at the same time. So that's a positive, too. So. You guys have any questions for me?
Kevin, I heard a lot of positives there, and a lot of that does look good. Just looking at the hospital, looks like the big problem is the same problem we've always had, and that's contractuals.
Yes.
Blue Cross Blue Shield really jumped up this last year.
I think they're a bigger. There's more and more people that has actually Blue Cross and Blue Shield, so there's more of that and less other commercial payers, and so that's the reason you see that we're not writing off any more to them than we have in the past. It's just that it's just the volume of Blue Cross Blue Shield patients have increased, and the other commercial payers have gone the other direction. So.
I was curious if they'd changed the percentage of reimbursement percentage.
No,
but it's the same.
No, it's the same. Yeah.
Okay.
So.
Probably not much hope of getting that down.
Not much hope. It's historically, we're right at 50%. If we put the Medicaid back in there, we would be almost 50%. That's pretty much where you're going to be anywhere in the state for a size of hospital that we are. So.
Thank you.
Mm-hmm.
Any other questions for Kevin? If not, thank you. Next, Dr. Kinsey for the Medical Staff Executive Committee.
All right, I'm going to start off by reviewing the minutes of the Medical Staff Executive Committee. We had a spirited discussion of the expanding nurse practitioner and physician assistant duties in the hospital. And I'm just going to kind of summarize that for you here because it's something that needs to come back to the Alva Hospital Authority. And I want it all the issues, or many of the issues at least, kind of fresh in your heads. Essentially, the Alva Hospital Authority bylaws currently state that only a physician can admit patients to the hospital. The med staff bylaws also say that only a physician can admit to the hospital. Currently, the discussion has been that that is really not feasible in rural Oklahoma, and specifically in our hospital. That with the volumes that we have in the hospital, and with the volume of physicians that we have here, that it would make a lot more sense to kind of go with what's becoming the national trend, especially in rural hospitals, but even in cities, to allow nurse practitioners and physician's assistants to admit patients. And we've kind of we've kind of been moving toward that with having physician's assistants and nurse practitioners in the emergency room, because they do look at patients and say, well, you know, I think this patient is sick enough to belong in the hospital, and they write initial orders and they put the patient in the hospital. Medicaid and Medicare are actually they will allow that. They allow nurse practitioners and physician's assistants to admit from the emergency room and to have admitting privileges, as long as the bylaws are written so that they can do that. If the bylaws don't stand behind it, then they don't stand behind it either. And so we've been discussing that. Ann Becker went through our current bylaws and proposed changes, which would not be very significant, really, just changing a few words here and there, rearranging some definitions, to make the med staff bylaws align with allowing nurse practitioners and physician's assistants to admit. And it's really just kind of a one-line change to the Alva Hospital Authority bylaws, because right now it says the only line that would really need to be changed in the Alva Hospital Authority bylaws is the line that says only a physician can admit. Would have to change. But the discussion kind of centered around where, if we allowed nurse practitioners and physician assistants to admit, then where do they belong on the med staff? Currently, only active members of the medical staff are allowed to admit, and active members of the medical staff are allowed to vote. So if nurse practitioners and physician's assistants were allowed to be admitting, would they be allowed to vote on the med staff? And if they were, there are potentially, right now, 6 of them, or always twice as many of them, because we supervise 2 to each one of us, twice as many of them for each one of us. So when we got to the med staff, there'd be twice as many mid-levels as there are physicians. So how does that work out? So the conversation got to that point, and then we kind of said, well, we're not to that point yet, so that's where we kind of ended it. But those were the issues that we were talking about, and that's kind of where things stood. Candace has done some talking to other hospitals about how they handled it. Some other hospitals allow votes, some other hospitals do not allow votes, some other hospitals allow mid-levels to admit, some other hospitals do not allow mid-levels to admit. Ann got here about, she had to be out of town. She was hoping to make it here a few minutes earlier. But she doesn't know what we were talking about, because this has been something that we have discussed in detail. But essentially, you know, that's kind of where we left it off. It seems that we are going to need to allow mid-levels to have admitting privileges to the hospital in order to maintain continuity here, in order to be sure that we always are able to have providers in the hospital. Sometimes when we're down to just a couple of providers here, the only providers we're going to be able to get are mid-level providers to have like hospitalist duties. And those might be internally our own mid-level providers, or they might be locum tenens hospitalist providers. When we talk about bringing in like a telehospitalist program, that might include only having a mid-level here with a physician somewhere else, and we need to work out how that works. So I think that we're moving toward proposing a change, and when we propose that change, it'll have to come back here. We'll have to kind of work through as the medical board. We'll have to look closely at the bylaws changes, both in the medical staff and in the hospital authority, review all that and decide what we want to do, and then send it back. Those are the issues that are coming up right now, and it's going to take a while to kind of iron out all of that. Did you want to add anything, Ann? I know you didn't catch everything I said.
Weather was an issue. It's just that it is a growing trend in Oklahoma in a lot of the rural areas for mid-levels because of the lack of primary care physicians. And also that does allow a lot of these rural hospitals who have trouble with getting primary care physicians to allow for a pediatric component in some of the hospitals.
Yeah. So that's kind of where things stand there. So that's just to bring up that old business and the issues that we had there. Then, as part of that, as Ann was reviewing the privileges, we found that our privileges form was kind of sorely out of date. So she reviewed and created a new privileging form for our mid-level providers. I believe it is included in your packet here, toward the back of my section.
The last 2 pages.
The last 2 pages there. This privileging form includes a section over to the left. As you see under medicine, there's 2 choices there that include to admit, diagnosis, and manage diseases of adults. Those are choices on there, but I don't want you to think that just because there are choices on there that people can necessarily check them and will approve them. This form, though, is, I think, a good form for us to use, and it was approved by the med staff. Then, let's see, the medical staff credentialing committee, we'll get to that in a second. Improvement to patient care, we're going to go over that, and the quality report and the CEO report. Okay, so next on my section here is the appointment to courtesy staff of Dr. Vikas Jain. He's our sleep medicine doctor, and he has requested privileges to interpret sleep studies. And let me try again. I recommend, I want to do it the right way. The medical staff executive committee recommends that we approve him. So I can do this.
Move.
I move. There we go. I can find it. I move that we approve the appointment to courtesy staff of Dr. Vikas Jain, MD, for sleep medicine.
A second.
We have a motion by Dr. Kinsey, a second by Darlene Sanderson to appoint to courtesy staff Vikas Jain, MD, sleep medicine interpretation. Roll call vote, please.
Klein,
Yes.
Gaspard,
Yes.
Hannaford,
Yes.
Kinsey,
Yes.
Knox,
Yes.
Sanderson.
Yes.
Dr.
Next.
Kinsey, let's just point out, we did get another night of sleep study
Oh,
recently.
yes.
So instead of just one night, we have 2 now.
2 a month.
Yes.
Yes. And hopefully more coming if we can keep filling them up. Although apparently Dr. Self didn't know we even had 1 yet. So now that he knows we have 1, maybe.
Dang. It'll be harder to get yours in, but.
Yeah, it will be, but. Next is Dr. Shirley Godavala. She's listed here as family practice. She's also a fellow in pediatric urology. She is coming to us as a locum tenens to work in the emergency room. She'll be working this weekend if we appoint her to courtesy staff. So I move that we appoint Dr. Shirley Gadawala to courtesy staff.
Second.
We have a motion by Dr. Kinsey, a second by Terry Klein, to appoint to courtesy staff Shirley Gadiwala, MD, Family Practice. Roll call vote, please.
Klein,
Yes.
Gaspard,
Yes.
Hannaford,
Yes.
Kinsey,
Yes.
Knox,
Yes.
Sanderson.
Yes.
And the form that you saw for the delineation of privileges is the next thing on the agenda. We're actually going to recommend, well, the med staff recommends that we approve that form, and I move that we approve the Allied Health Providers Delineation of Privileges form.
Second.
We have a motion by Dr. Kinsey, a second by Bo Hannaford, to approve the Allied Health Providers Delineation of Privileges form. Roll call vote, please.
Klein,
Yes.
Gaspard,
Yes.
Hannaford,
Yes.
Kinsey,
Yes.
Knox,
Yes.
Sanderson.
Yes.
Now, based on that new form, all of our mid-level providers have filled out that new form requesting privileges using that new form. And the med staff has reviewed those requests and has recommended approval of the requests for privileges of each of the providers here. So,
Okay, hold on one second. Now, so does that, but make sure I'm clear on this, because we haven't changed bylaws yet. This does not affect anything with that.
none of the requested privileges include admission privileges.
Okay, so this is
At
just
this
a,
time. None
for
of
them to
the,
continue in the way that they have been doing
yeah,
business.
that's what I wanted to make clear.
Yeah.
None of the requested privileges include admission privileges.
We'll need to change our bylaws, and then we will,
And then they can go
Grant
back
admission
and check those
privileges.
boxes that include admission privileges.
and then we'll have to vote on that.
And then we go back and vote on that.
Okay.
Correct.
Okay,
Dr. Kinsey, just to point out, we did not get Emily Nayers.
Correct.
So-
She's not on the list.
Oh, she's on mine. You must not have the updated one.
She was on our list from,
From Med
Oh,
Med
sorry,
staff.
so sorry.
from
I'm
Med
not-
Staff.
You're right,
She's not
okay.
on the list.
Very
here.
good, thank you.
Can I do them all at once? No, darn it. All right.
We can do this. Come on.
I think we'll do it that.
All right, I was hoping you'd say we could, but, in any case. So, I recommend that let me try again. I move that we approve the delineation of privileges for Brian Nutter,
Second.
APRN.
Second.
we have a motion by Dr. Kinsey, a second by Steve Knox, to approve the delineation of privileges for Brian Nutter, APRN. Roll call vote, please.
Klein,
Yes.
Gaspard,
Yes.
Hannaford,
Yes.
Kinsey,
Yes,
Knox,
Yes.
Sanderson.
Yes.
I move that we approve the delineation of privileges for Ann Becker, APRN.
A second.
We have a motion by Dr. Kinsey, a second by Darlene Sanderson, to approve the delineation of privileges for Ann Becker, APRN. Roll call vote, please.
Klein,
Yes.
Gaspard,
Yes.
Hannaford,
Yes.
Kinsey,
Yes,
Knox,
Yes.
Sanderson.
Yes.
I move that we approve the delineation of privileges for Carrie Lutzen, APRN.
Second.
Klein?
Yep.
So we have a motion by Dr. Kinsey, a second by Terry Klein, to approve the delineation of privileges for Carrie Lutzen, APRN. Delineation. However you guys want to say that.
Delineation.
The confines did not work for me. Roll call vote, please.
Klein,
Yes.
Gaspard,
Yes.
Hannaford,
Yes.
Kinsey,
Yes,
Knox,
Yes.
Sanderson.
Yes.
Oh, my God.
You guys
A few
wanna
more
make fun of me?
times to get it
Somebody else?
I move that we approve the delineation of privileges for David Holland, APRN.
So you gotta say it slow.
Slow.
Second.
We have a motion by Dr. Kinsey, a second by Bo Hannaford, to approve the delineation of privileges for David Holland, APRN. Roll call vote, please.
Klein,
Yes.
Gaspard,
Yes.
Hannaford,
Yes.
Kinsey,
Yes,
Knox,
Yes.
Sanderson.
Yes. Jason, we love you and appreciate you.
I'm sure you
We
do.
do.
Mhm.
I move that we approve the delineation of privileges for Gwyneth Holderby, APRN.
A second.
That's Sanderson.
I didn't think anybody was going to.
Had a motion by Dr. Kinsey, a second by Darlene Sanderson to approve the delineation of privileges for Gwyneth Holderby, APRN. Roll call vote, please.
Klein,
Yes.
Gasper,
Yes.
Hannaford,
Yes.
Kinsey,
Yes.
Knox,
Yes.
Sanderson.
Yes.
I move that we approve the delineation of privileges for Lindsay Head,
Second.
PAC.
You got a third?
You go.
Way to go, Jerry.
We have a motion by Dr. Kinsey, a second by Terry Klein to approve the delineation of privileges for Lindsay Head, PAC. Roll call vote, please.
Klein,
Yes.
Gasper,
Yes.
Hannaford,
Yes.
Kinsey,
Yes.
Knox,
Yes.
Sanderson.
Yes.
Bet you're glad that's over.
I am actually glad that's over. Dr. Kinsey, do you have anything else at this moment?
Automatopoeia.
Would you like to delineate that?
Yeah.
No, I'm sorry. I don't think I have anything else.
All right. Thank you for your report. Next is the coffee report. Harley?
I'm assuming you guys all have a copy of it.
Yeah.
Yes, we do. Coffee.
Yes.
Pretty much all the old business got corrected in the past moment. A few of our departments were either didn't have QIs or didn't know that they had QIs, so I'm working with them all to get everybody to get QIs, quality initiatives. So it's quality improvement initiatives. So it's things that we need to improve on, and we set goals and try to reach those goals. And if you don't reach the goals by the deadline, then you go back in and you revamp it and go at it again until you get it. Pretty much everybody was compliant with all their tasks. Mary Harold was missing from the meeting, so that's why a whole bunch of your pages say report will be decided next month. And Pharmacy and Therapeutics met for their quarterly meeting. They discussed several issues with like ordering medications in bulk versus smaller quantities, especially medications that we don't use very often. And that there will be a new policy coming forward soon about promethazine IV no longer being used. We also took medication testing for the nurses, and Zach is going to send us some competencies on that, or some education. And also utilization review met last month for their quarterly meeting, and we covered several things. Everything was pretty much compliant and in line. We approved a new blood, yeah, we reviewed the blood administration appropriate diagnoses. Because if your hemoglobin is above a certain value, insurance companies want there to be a specific diagnosis and lots of documentation as to why we are giving blood when their lab value is above a certain value. So we went over that and posted those, and we're working on getting it in the computer.
So that it's right there in front of the doctors to choose from
Okay.
the appropriate documentation.
And then we should also have some satisfaction surveys in there as well.
Those are out on the table so that we don't have to make copies for everybody. It's the one with the black bars.
And they were all pretty good, I think.
Looked like we needed to do a little bit more education on diet,
Yes.
nutrition.
And in other news, we're working on implementing a token system, which will be an online satisfaction survey. So if somebody comes into the ER, instead of giving them a satisfaction survey to say, here, fill this out before you go, we're gonna try giving people a card with a certain digit number. I think it's 5 or 6 digits, and it'll be individual, and it'll still be anonymous, and they just go to our website and have a link, and they just go in and enter that 5 or 6 digit code, and it pulls up their survey, and then they just fill it out at home whenever they want.
And can we do that if I mean, say somebody came in and maybe it was an emergency situation where they then were being transferred out? Is that something where they can be mailed to them?
I would assume so, yeah.
Because we have to have a certain number of these people need to be responding, correct?
It helps. I mean, right now, I haven't went over the numbers in the ER log to see how many surveys we're getting per patient, but I know it's not very high.
Because don't we for,
And it's not just for ER, it's urgent care as
right.
well. So-
But I mean, for our reimbursements,
For meaningful use,
for
yeah.
meaningful use, we have to have a certain percentage.
Right, over 5% this year.
I thought that was patient portal.
That's patient
Our
portal
patient
sign
portal,
up.
but yeah.
That's patient
Yeah.
satisfaction survey.
All right.
And if you guys would like for me to include that question in our satisfaction survey, I can, especially if we're going to be, if that's part of the deal, I can add it into our ER satisfaction survey and ask if they've signed up for the portal and if no or not. Once we get the token system going.
And then
It's
we
not
can
gonna hurt
pursue
to
it
ask.
afterwards.
Yeah.
Mhm.
It's a good idea.
More likely to get more people to sign up on it. I mean, it just depends upon the
Think
situation.
about it again, yeah.
If they're being transferred out of here, you're probably not going to even be handing them a card. That's the least of our worries.
Right.
At that moment. All right. Anything else, Harley? First month on your own, you all right? All right, very good. Well,
The
thank you.
second day on his own is when surveyor showed up, I believe.
Oh, wow.
I thought he was going to pass it
Gonna break
out.
That's like
it in
Friday.
right.
He did well.
Well, Harley, thank you. Thank you for your report. Next is under improvement to patient care. Dr. Kinsey, I'm going to defer to you on some of these. This is what you guys, these are some of the policies that you guys talked about. Is that correct?
Oh, okay.
I mean, I have them in front of me, but you might be able to. The first one is,
Contract review, if you'll remember, that is specifically reviewing contracts on an annual basis for compliance and or renewal. And we go through each contract to evaluate them for those things on that first page. And so that was a list of contracts that each of us reviewed for compliance or approval. And they were all compliant.
okay. Is there any questions about that? I think there were 6 of them for this month. Okay, the next item then is the Policy Review Committee Policy and Procedures. This is a new policy.
And yes,
This is a new policy on policies.
we have a policy for making policies and reviewing them. So all the policies have to flow through the policy committee.
On policies.
On policies.
It's our policy.
And it is our policy to have a review committee. So this is more or less redundant.
This is our, yeah.
So we need a motion.
Oh, I move that we approve the Policy Review Committee Policy and Procedures policy.
Second.
Second what she said.
We have a motion by Dr. Kinsey, a second by Steve Knox to approve the Policy Review Committee policy and procedures. Roll call vote, please.
Klein,
Yes.
Gasper,
Yes.
Hannaford,
Yes.
Kinsey,
Yes?
Knox,
Yes.
Sanderson.
Yes.
The next item is the TB risk assessment. And there were no changes made to it, is that correct? And it's passed through med staff?
It's it's pretty standard every year evaluation.
So the rest of these are things we have
Already.
in place,
Yeah.
we've already voted on in the past.
Yeah, some of them are annual reviews.
Some of them are annual reviews, wasn't,
The rest of them are all existing, and there were no
Was-
changes. That's what I have.
yes, sorry, that is
Okay.
correct.
Except for maybe the last one.
Correct, that was
And
changed.
the last one is the new one,
Okay.
or there are some changes.
Okay. So, the first one is the TB risk assessment.
I move we approve the TB risk assessment 2014.
Second.
We have a motion by Steve Knox, a second by Bo Hannaford to approve the TB risk assessment 2014. Roll call vote, please.
Klein,
Yes.
Gasper,
Yes.
Hannaford,
Yes.
Kinsey,
Yes?
Knox,
Yes.
Sanderson.
Yes.
The next one is the compliance policy and procedure manual, and there were no changes to it either.
Motion to approve compliance policy and procedures manual.
A second.
We have a motion by Terry Klein, a second by Darlene Sanderson to approve the compliance policy and procedures manual. Roll call vote, please.
Klein,
Yes.
Gasper,
Yes.
Hannaford,
Yes.
Kinsey,
Yes?
Knox,
Yes.
Sanderson.
Yes.
The next item is the hospice policy and procedure manual, and there were no changes made to it either.
I move we approve the hospice policy and procedure manual.
Second.
We have a motion by Darlene Sanderson, a second by Terry Klein to approve the hospice policy and procedure manual. Roll call vote, please.
Klein,
Yes.
Gasper,
Yes.
Hannaford,
Yes.
Kinsey,
Yes.
Knox,
Yes.
Sanderson.
Yes.
The next item was the risk management policy and procedure manual, and there were no changes made to it either.
Move to approve the risk management policy and procedure manual.
Second?
We had a motion by Bo Hannaford, a second by Dr. Kinsey to approve the risk management policy and procedure manual. Roll call vote, please.
Klein,
Yes.
Gasper,
Yes.
Hannaford,
Yes.
Kinsey,
Yes?
Knox,
Yes.
Sanderson.
Yes.
The next item is the safety policy and procedure manual, and there were no changes to it.
I move we approve the safety policy and procedure manual.
Second.
Who was it?
Ted Heath.
Huh?
We'll go
Did
with
he?
Bo.
All right, Bo. I have a motion by Steve Knox, a second by Bo Hannaford to approve the safety policy and procedure manual. Roll call vote, please.
Klein,
Yes.
Gasper,
Yes.
Hannaford,
Yes.
Kinsey,
Yes?
Knox,
Yes.
Sanderson.
Yes.
The next item is the wound care policy and procedure manual. There were no changes made to this.
I move that we approve the wound care policy and procedure manual.
A second.
We have a motion by Dr. Kinsey, a second by Darlene Sanderson to approve the wound care policy and procedure manual. Roll call vote, please.
Klein,
Yes.
Gasper,
Yes.
Hannaford,
Yes.
Kinsey,
Yes?
Knox,
Yes.
Sanderson.
Yes.
Okay, next is the reinstatement of the medical staff bylaws. Dr. Kinsey, do you want to say anything about that?
So reinstatement is the official term when we take all the previous changes and put them back into the bylaws, make the corrections that have been made over the years, all the changes that have been made over the years, put them back in, and also we can make any new changes. There have been some new changes, and do we have the summary of that in
Yes.
here? I don't remember if it's.
It's in under your section, right before the
I don't remember seeing it.
the privileges form.
Sure.
So it'll be the third page in from the back.
So most of the changes are just corrections in spelling and little minor corrections. And putting in corrections that have been changed over the years. And then some of it was to include the EHR, and then wasn't there a whole paragraph changed?
Telemedicine.
The telemedicine. Is that not included here?
Yeah, 5, 6, and 5, 7 on page 38 through 39.
All right, sorry. I don't see it on my, oh, there it is.
Down towards the bottom.
Down toward the bottom. Telemedicine was added to the credentialing process. And so those are the changes that have been added to the bylaws. They've all been updated. She changed all of it, and we're now recommending to approve the reinstatement of the med staff bylaws. So the medical staff recommends that, and I move that we approve the reinstatement of the medical staff bylaws.
Second.
Okay, I have a motion by Dr. Kinsey, a second by Terry Klein to approve the reinstatement of the medical staff bylaws. Roll call vote, please.
Klein,
Yes.
Gasper,
Yes.
Hannaford,
Yes.
Kinsey,
Yes.
Knox,
Yes.
Sanderson.
Yes.
Okay. Thank you, everyone.
I'd like to know when Dr. Kinsey actually has time to practice medicine and actually see a real live patient. Must be frustrating, but I commend
There's
you.
plenty of
Thank you.
patients.
Yeah, there's plenty of patients, but boy, you spend a lot of time on other things. But I know they're necessary.
Next is Rita with the Sheriff Convalescent Home Report.
Yes. And for April, we had Tanya Escobar, which is our administrative assistant, went to, I believe it was an Oklahoma hospital or healthcare authority meeting that was held in Enid. It was just like a training meeting to go over different billing processes and things that she has to do. And I think she learned a little. She knew a lot, so maybe she freshened up a little bit. As for the new pergola, thank you, Janet, so much. Janet worked really hard on that. We had our first, get ready, PUP, picnic under the pergola last week. And we have a picture for that, and I'll try to get that posted to our Facebook page. But they all enjoyed it, and the weather was good. Last week, as you know, was Healthcare Week, but it was also National Nursing Home Week. So we did all kinds of things for them. There was chocolate-covered strawberries throughout the week. I don't know what all of the activities did, but they provided a lot of different things for them during the week. Our skilled nursing days were up to 175 days from 127 days from March. So we were busy, as always. We try to be as busy as we can. Some of those people have gone home, so our days will probably be down for May. We're trying. I've got 2 couples that are actually, I have one set of couples that will be moving in June 1st, and they will be coming from Shattuck, and then we have another possibility of another couple that will be moving in sometime in the near future, I hope. We've had a couple of other people that have inquired. We're still beating the streets, looking for something. We had 6 or 7 residents that loaded the bus and went to Ingersoll the last part of April. They had a wonderful time. They met some of their families in Ingersoll and had barbecue, and they come back complaining because they ate too much. But they all had a really good time. And I do have to say, we had one resident that was there with their family member that has since passed. We got wonderful pictures, and we gave those to the family, and they are just priceless to them. They had an excellent visit for that, and I can't tell you how appreciative that family is. Anytime we try to get pictures to give to our families, that's their last memory, and they need those pictures. We also went to Canton Casino on May 5th, and we had 2 residents that decided they wanted to go, and they had a really good time. They loved their lunch, and we stayed for a couple hours and came home. We will be doing that again. They like to do that. Hopefully we could get a couple of more, you get what you get. We also have, this is bittersweet, we have a lot of nursing students that have graduated or they've been accepted to nursing school, that they're going somewhere else, or we have one that will be going to PA school. We want them to continue on. I ask them constantly to please come back home. You know, you can go spread your wings a couple of places, but think about coming back here to do that. We have a lot of nursing students on 3 to 11 that hopefully we can get some return people back, either to the hospital or just to the community. They're very important to us. Christy, Marcia, and I will be attending a free health department sponsored meeting in Enid on Thursday and Friday regarding reduction of psychotropic drugs. This is a big CMS guided tour. They're wanting us to decrease those meds from the elderly people, and we have seen evidence that that is something that needs to be done, so we'll be going Thursday and Friday to that this week. Any questions?
So did any of them strike it rich while they were at the center?
Well, no.
Oh, just read.
Great. I bought their lunch and I gave them spending money.
Well, good. I'm glad you guys were able to do stuff like
And
that.
they like to watch me play.
Very good. Thank you, Rita. Next, Kelly, homestead report.
Well, as Kevin mentioned, our revenue was down and our occupancy was down. It's a reflection. It's reflected in the revenue. We are pretty much even, less than 2% difference from where we were last year at this time. So as far as paid occupancy is concerned, just to kind of tell you what was going on last year, we had rented 6 apartments to employees of Universal Field Services, an oil field company that they left, probably spread out between 4 to 6 months after that. So we maintained pretty well, but we've now seen this stay about the same for about a year. So like I said, the occupancy is about 1.9% less than that, and it's just about even with where we were last month. We didn't have anybody move in. We didn't have anybody move out that was a paying guest. We did have a nurse practitioner that was staying with us after moving to town, but had bought a house, and her and her family moved into town. The transportation stats for April were significantly increased. We had a 61% increase over March. 82 resident activities we took people out to town, whatever they needed to do. It might be a doctor's appointment, might be therapy, might be a hair appointment, might be just a trip to the store. But 82 times in April we did that. And that did include one physical therapy patient several times during the month. But even without that, our transportation numbers increased. We had a tea party. It's not in the report, but we had a tea party for kind of Mother's Day. It wasn't on Mother's Day, but we had a tea party. And Karen King came and spoke to the group of women there, and it was very entertaining. And so that was a good time had by everybody there. We had a safe driver education class. It's an AARP program that was provided by a local business that came out and provided that training. With that training, the senior drivers can get a discount on their insurance if they've had. It's an all-day long class also. So we have some that I wish wouldn't get behind the wheel, but we have some that are still all right, and I'm glad to see them get the training. But I think anybody that's had grandparents or great-grandparents or parents to get old and get into that shape, you know when they're out and when to stay off the sidewalks. That said, our transportation numbers are up because more of our residents are selling their cars. So we've got another one that told me last week, hey, I don't need that reserve parking spot anymore, I'm selling my car. So that's happening. I went on vacation in April, and I came back to a bunch of people that work for us that are moving away. So I've got several openings right now. One in activities, which I have interviewed one candidate. Hope to be making an offer soon on that position. See what happens there. We've got positions open in the kitchen. I have hired a full-time housekeeper to fill a position that isn't open yet. So, but I've got a resignation for a housekeeper, and I've got a housekeeper hired. And then I think the other position that I'll just make note of is my office assistant, Aubrey Northcutt, has been accepted into OSU's College of Medicine. She'll be leaving July 17th. So we're still twisting her arm. She thinks she wants to be a radiologist. I'm trying to convince her that she wants to be family practice in a small town. And so I'm recruiting for that position. I've got a little bit more time for that one than the others, but that's an opening that I have available. We've been installing senior-friendly thermostats in the apartments, a few at a time every month, to hopefully reduce our number of heating and air-related maintenance calls. And so far that I can tell, that is working. And I think by the time we get through to most of the apartments, we'll be in good shape there. Our residents do control their own thermostats in their apartments, so it's important that they have one that they can effectively operate. A couple things coming up. Memorial Day, we'll be hosting hospice and the foundation's annual remembrance celebration and butterfly release. That will be at 10 a.m. On Memorial Day that morning. If you're looking for a Memorial Day activity, it's a really good one. We've hosted that at the nursing home in years past, and then one tried at the homestead this year. So we'll be in the lobby for the program, and then step outside and release the butterflies. Another thing next week is going to be our, I guess every couple of years, between people leaving things behind and that sort of thing, that they're not, the items are not worthy of throwing in the trash, but they're not anything that we need to hang on to as that stuff piles up. We need to have a sale. We'll be having a sale on 27th and 28th. There's some things that the city's declared surplus that we can include in it, and it's going to be, we've got holiday decorations, we've got silk flowers and plants and stuff, and then we've got furniture and some other things that we'll be selling. We've got clothes that have been donated by Lottie Dawes over there. She donates clothes to the gift shop, and they're clothes that haven't sold in the gift shop. I don't know, you might look through it. Our seniors don't want them, but somebody else might. So come on out. The funds raised from our sale are for, we'll go to the foundation and our homestead activities line item. Does anybody have any questions? I will say we continue to get inquiries, and it's from a younger demographic of seniors, and that's encouraging. But it also takes them longer to get from, I really think I want to do this, to, yeah, I'm going to go ahead and do this. They're trying to manage whatever state stuff they have to do, take care of, and that sort of thing. I have heard from several of our residents that hey, it took me 3 years to get out there from the first time that I checked. So we continue to get inquiries.
All right. Thank you, Kelly, for that. Anything to report from the foundation?
I do.
Okay.
Foundation board met in April, and for a regular meeting, the major things. Go here. Hold on. That we, and actually prior to that, I think I mentioned that we had approved moving forward with enhancing our endowment funds with the Communities Foundation, and we now are invested with them for the purpose of endowment at about 110. I'll look it up if anybody wants to know the exact. But it's about $110,000, $120,000, which is our starting jumping off point for hopefully a 10-year, $25 million run at an endowment. We talked with Kevin and with our board, and if we are endowed at $25 million, that's $1 million or more back to Share Medical Center every year, and that's our goal. By 2025, that's what we want to accomplish. So we have establish that endowment fund, and if anybody had contributed, the way we've set it up, any contributions we will that are unrestricted in nature, 70 to 90% of those funds will be contributed to the endowment fund. If it is a donation specifically for endowment, 100% of those funds are for the endowment. And it is delineated in our fund documents with the Communities Foundation that any monies that are solely restricted for endowment cannot be taken out of this fund unless it is to establish another endowment fund for the Share Medical Center Foundation, or the Share Medical Center. The other things that we've been working on, we have been making some contributions back to the medical center with contributions that we've received. The Pergola project's been mentioned, and thank you, Janet, for your work on that. We have sent back, and this is a share trust gift from last year or so, but probably $67,000 for physician recruitment, which is being used for recruiting firms that we're hopefully going to get a physician here before long. And we also have been able to purchase some hospital mattresses, so $5,000, a little over $5,000 for hospital mattresses, and we are preparing to make some more contributions back for the purchase of a walk-in tub for the nursing home and the remodel of a room over there. We're projecting probably total contributions in the neighborhood of $22,000 to $25,000 from the foundation back to for nursing home projects there. And I know that one is greatly needed over at the nursing home, so we're kind of excited that we're getting to a point where we're going to be able to do that. The other thing I will mention is that we awarded last week at the High School Awards Assembly the Alva Hospital Authority Scholarship, which was set up prior to the foundation. But the foundation went through that process, and we had, what did we have, Terry, about 17 applicants?
Yeah, it was a bunch.
Yeah, it was a lot. And the majority of those were from Alva, but we did have applicants from Freedom and Burlington, and maybe Cherokee. But Nicole Ritter was awarded that scholarship. She plans on going to med school as a family practitioner, and so we feel like she was certainly, there were a lot of qualified candidates. It wasn't a blowout, but it looks like there's a lot of kids looking for healthcare careers, and that's kind of exciting. And one more thing, you will be in the next few weeks receiving in your mail, if you have a business, you'll be receiving it in your home, at your business, wherever you take mail. An announcement of our endowment campaign and a opportunity to look into that for whatever giving you might have in mind for this year, as well as we're hoping that we get some people that'll let us know, and it's not necessary, but we're hoping just for planning purposes we get some people that'll let us know if Share Medical Center is something they've identified in their will or their estate documents, and that'll help us keep track. If we know how much, it'll help us keep track of how we're headed towards achieving that $25 million goal.
All right. Kelly, thank you very much. Do we have anything for St. Anthony's? No. Okay. Next, Bo, anything from City Council?
Yeah, just real quickly, we are close to finalizing our budget for next year. We approved last night some new appointments, which obviously will affect our group. The water meter project that we talked about last time, we actually did not accept that bid, and we're going to rebid it with some technicalities and some of the wording. So that'll go out to rebid. We rehired our city manager last night. And then one that is probably most interesting in this group, we did have some discussion about the proposed new clinic, urgent care. After talking to our city attorney, basically charged our city manager to make sure he notifies them of the procedures and policies to follow with our new ordinance, and make sure understand that those have to be met before anything moves forward on that issue. And that would be my report.
Oh, do you want to talk a little bit about MASH?
We did have Northwestern, Share Medical, and Northwest Technology. I put forth a proposal, raise some money, where we're going to have our first inaugural MASH camp this summer. And it is basically a camp for upcoming seventh graders. We're going to limit it to 30, but we had 39 applications, so we're going to take all 39. But what it is basically a camp. We want students that are interested in math and science, that are interested into the medical field. So we're going to have a 3-day camp where they'll stay overnight at Northwestern. We've got days where they will be CPR certified, first aid training. We've got a kind of we call it a CSI type scenario, to where they're going to try to figure out and also see how the different entities work together. We're going to have a day up here at Share Medical where they will see the different departments in different areas, learn about what they do, what type of salaries they can make, and what type of living they can make in Alva, Oklahoma. So it's a ploy, again, to kind of start recruiting our own, growing our own, and getting some of those people into our programs at Northwest Technology Center and Northwestern. And we were very excited to get 39 applicants. They will be decked out with T-shirts, scrubs, anything we can get them excited about the healthcare profession.
And what age group is that?
It's going into the 7th grade.
Going into.
Our goal is we're going to get into the Lincoln with the 5th grade class, start talking to them about it, so I can incorporate some of the lessons of why science and math are important for those careers. Hit them with this camp, and then our next goal that we just discussed is maybe their sophomore year, have another camp where they would almost do internships in different areas at the hospital, all over. I mean, nursing home, homestead, and just see what different careers they could choose, and then have a big career fair their junior year.
Cool.
For recruiting.
Cool. That's neat. All right. Thank you, Bo, for your report. Under the chairman's report, again, discussion of the AHA bylaws, as Dr. Kinsey mentioned earlier, upon an approval by med staff to change the privileges for mid-levels. Once that happens, we will then need to look at our bylaws, and we will need to have ours looked at to be able to be changed to accept for them to have admitting privileges as well. So that will be coming down the pike. That'll be something that we'll need to do. I don't know if we have any type of time frame, but that will be something we will have to look at and soon. Okay. All right. Any other discussion about that? All right. If not, we are adjourned.